Nasogastric tube insertion is a common medical procedure. It involves passing a soft, flexible tube through the nose, down the throat, and into the stomach. This tube can be used for various purposes like feeding, giving medications, or draining the stomach's contents. Before beginning, it is crucial to explain the procedure to the patient. Clear communication helps reduce anxiety and encourages cooperation. Describe the process, the sensations they might experience, and the importance of the procedure for their well-being. Patient comfort is paramount. Position the patient upright, preferably at a 45-degree angle. This positioning aids in easier passage of the tube. Ensure adequate lighting to visualize the nasal passage adequately. Gather all necessary equipment before starting. You will need a nasogastric tube of appropriate size, water-soluble lubricant, a syringe 10 cc or larger, a cup of water with a straw, a stethoscope, pH strips, tape for securing the tube, and gloves. Once you have all the equipment, measure the NG tube. This ensures the tube reaches the stomach without going too far. Measure from the tip of the patient's nose to their earlobe and then to the xiphoid process, the bony point at the bottom of the breastbone. Mark the measured length on the tube using a permanent marker. Lubricate the tip of the NG tube generously with water-soluble lubricant. This eases insertion and minimizes discomfort for the patient. Gently insert the tube into the chosen nostril, directing it straight back towards the ear. If resistance is met, try slightly rotating the tube. As the tube reaches the back of the throat, ask the patient to tilt their chin towards their chest and begin swallowing. This helps guide the tube down the esophagus and into the stomach. If the patient coughs or shows signs of distress, pause the insertion immediately. Check the patient's airway and ensure the tube has not entered the trachea. Once the measured length of the tube has been inserted, it's crucial to confirm its placement in the stomach. Confirming NG tube placement is vital. Never assume the tube is in the stomach without verification. Air aspiration. Attach the syringe to the end of the NG tube and gently aspirate a small amount of air. If you hear a whoosh sound through the stethoscope placed over the stomach, it indicates correct placement. pH test. Aspirate a small amount of gastric fluid using the syringe. Test the pH of this fluid using pH strips. A pH of 1 to 5.5 typically indicates gastric placement. Secure the tube properly to prevent accidental dislodgement. Use tape to secure the tube to the patient's nose. Leave enough slack to allow for movement without pulling. Post-procedure care is essential. Monitor the patient for any complications such as nausea, vomiting, or difficulty breathing. Keep the area around the tube clean and dry. Provide oral care to prevent dryness and discomfort. Remember, patience and clear communication are key to successful NG tube insertion. Always prioritize patient comfort and safety throughout the procedure.